Okay, for the physical preparations for surgery, you're going to ensure that all the other steps were done first. So now it's time for the patient to come in for the surgery, and you're going to get them ready to go back into the operating room. So you're going to first introduce yourself to the patient. You're going to identify your patient with 2 patient identifiers, name and date of birth. And then you're going to ensure that the pre-operative assessment was completed, which was that H&P that we did earlier. You're going to assess all the patient's vitals again. You're going to verify that the admission preparations were completed, and you're going to check advanced directives and make sure that they're in the chart. And then you're going to, with the patient, identify the expected outcomes of the surgery. And now you're going to actually start the physical part of it. You're going to go ahead and wash your hands. And then you're going to help the patient into a hospital gown. You're gonna have them remove any personal items, remove their makeup, their nail polish, any kind of hairpins or jewelry, and make sure that they give all those valuables, anything that's valuable, money, things like that, to the caregiver that will be with them. You're gonna ensure that the patient followed all of the preoperative instructions, including like the fluid and food restrictions, any of the medication restrictions, bowel and skin preps, make sure that those were followed, and that medications that were given or that they were told to take before surgery were actually, they did take those. You're going to make sure that all of your consents are signed. You're going to check allergies, make sure the patient has on the appropriate armbands, make sure that your H&Ps are in the chart. So basically you're just ensuring that the whole chart is together. The pre-op assessment, the H&P, the consents, the advanced directives, all of that stuff is in there ready to go if somebody needs it. You're going to make sure that all of the lab work and studies that were ordered are done. So any kind of type and crosses, EKGs, chest x-rays, things like that are all done and in the chart. You're going to instruct the patient to go ahead and void, have them empty their bladder. You're going to start your IV. You're going to administer any kind of preoperative medications that you have to give the patient before surgery. You're going to apply compression stockings if they're ordered, ICDs if they're ordered, and then you're going to wash your hands, put on gloves, and you're going to prep the surgical site so that it's ready to go when surgery is ready to start. Then you're going to wash your hands again and apply clean gloves again. You're going to perform or start a catheter if that's ordered, and then you're going to go ahead and put the patient's cap on over their hair or their head, so that they're ready to go back to surgery. So at that point, once you're done doing all that, they can stay in the room. The family and caregiver can stay in the room up until the point that the patient leaves for surgery. When it's time for surgery to start, you're going to help the patient onto the stretcher that's going to take them back to the operating room. And you're going to instruct the family and the caregiver to go to the waiting room and wait for the patient to come out. Once all of that part is done, the patient is going to go back to surgery. You're going to evaluate that the patient knows the surgery procedure, the risk and the benefits. You're going to have the patient repeat any of the instructions that are needed for pre-op. You're going to monitor the patient for signs and symptoms of anxiety. You're going to ask how the patient and family are feeling. This is before they're back in the operating room, before they go back after they're ready to go. So you monitor for anxiety, feelings of surgery, have them tell you the preoperative instructions. You're gonna ask them what they're expecting and what they think is gonna happen in the recovery room, just so that you're aware of what their thoughts are on the procedure. And then you're gonna identify any kind of unexpected outcomes. When you're done doing all that, you're going to document the pre-op physical prep. You're going to record the disposition of the patient's valuables and belongings and where they went to in the appropriate logs. And then you're going to report the lack of signed consents forms or the failures of the patient to maintain an NPO status. So all that would have to go to the surgeon or the doctor before they started the procedure. that is the full list for your preoperative prep, physical prep.